the founders of TRI. What were they doing?
It was a live test, actually. The video shows a room full of people. Human being on an average can have about 80 kilograms. They reached 80 kg, and the people are keep shouting, add more, add more.
All dentists know the common career paths, but how do you know which path is right for you, and are there other options out there?
On this podcast, we will be chatting with industry experts. We want to bring you the knowledge and resources you need to take your career to the next level and break down those industry secrets interview by interview.
We are here to ignite a revolution in the dental landscape
and help you, the dentist, build the career you have always wanted.
I'm Dr. Cassidy Reeder.
I'm Carter Frank.
And welcome to the Revolution Dentistry Podcast. Welcome, everybody, to another episode of the Revolution Dentistry Podcast. I'm your host, Dr. Cassidy Reeder, here with my co-host, Carter Frank. We're here to help you with strategies to build lasting success for yourself and your family. Today, we have the pleasure of introducing a legend in the dental and implant industry, Dr. Amir Gordji. Thank you so much for joining us today.
Hey, thanks for having me here. Pleasure to be here.
Of course. You know, I'm going to introduce him a little bit. As a dentist, implantologist, and digital workflow patent owner, Dr. Amir Gordji is a seasoned professional with over 25 years of experience in the dental industry. Dr. Gordji's experience ranges from practicing to workflow development, training, clinical studies, and product management. As the former head of the workflow and material team at SprintRay, he played a pivotal role in advancing digital dentistry and 3D technologies. Dr. Gordji is currently serving as the Director of Clinical Affairs at TRI Dental Implants, the first and only implant in the world without an abutment, making it a leading implant technology in the implant and all-on-X markets. Throughout his career, Amir has been involved in the creation and innovation of innovative solutions and patents that have enhanced digital workflows, reflecting his dedication and passion to advancing the dental field. With a rich background that includes 15 years of clinical experience in private practice, Amir possesses a deep understanding of various workflows, procedures, and patient needs. Outside of his professional pursuits, Amir enjoys spending quality time with his family, exploring new destinations through travel and outdoor activities like hiking. Dang. Dr. Amir, that is an incredible career that you've had so far. If you don't mind me asking, what has been one of the best and most fun destinations that you've been to on your travels?
Best and most fun destinations I have been in my travels, I would say, I love traveling, first of all, and I have been to many places. I want to say around the world.
Uh-huh.
But if I want to say one of the best ones out here, it was we went a couple of times. We went to Miami and to overall to Florida, Orlando, Florida, and one of those we had this cruise going to Caribbean, and that was really, really fun.
Whoa.
It was a fun time.
That sounds fun.
I did one of those cruises once. Where did you all go? Where did you go?
So we were in Orlando. I mean, it was like a road trip in Florida. We started in Miami, going to the Orlando, being in Orlando, going to Daytona, and from there going to Fort Lauderdale.
Okay.
And from there getting to the cruise, going to the Caribbean, staying there for like I don't know, 5, 6 nights, I think.
Okay.
And then getting back to Lauderdale again, going back to Miami. So it was a long road trip and a cruise combined, but altogether it was a very fun time.
I mean, cruises are fun. The last time I went on the Caribbean cruise, we went to Jamaica, we went to the Cayman Islands, and then to Cozumel. And man, it's a good time out there. That water, when it's crystal, just completely see-through, you can see the fishes little nipping at your toes in the beach. That's crazy fun.
Yeah, that's really, really fun.
All right, thank you. I just was curious. Go ahead, Carter.
I need to get on more cruises. You guys are making me feel like I'm missing out. Well, just to get us started here, Dr. Gordji, can you share your journey in dentistry and how your focus shifted towards implantology and advanced procedures like all-on-X?
Yeah, wow. Okay. So With that question, you actually took me to a long, long time ago.
Mm-hmm.
Um, so I think I was in high school, maybe in 10th grade or so. I was thinking of my future at that time, right? Like
Mm-hmm.
anybody else. It was between computer science and dentistry, right? Completely different skills, different
Yeah.
passions. I think at that time, computers and computer sciences, they were booming and getting a lot of attentions, and people, were getting towards it. So, however, at the end, I picked dentistry as the path of, to my life's journey. I owe a big part of my choice to my childhood dentist, who was a
Mm-hmm.
great dentist. He still is. He helped me to realize how important it is, to help people to improve their quality of life, and that became my passion, and that's how, I started my journey in dentistry. After completing my dental school, I spent about 15, 16 years, 15-ish, in private practice,
Mm-hmm.
focusing on, general dentistry mostly. Um, Around that period, not only I tried to strengthen my technical skills,
Mm-hmm.
but also try to understand, patient needs, expectations, and the challenges, that comes with it, especially with the traditional dental.
Mm-hmm.
And it was during those years in private practice that really I came across, numerous cases. I mean, we all come, right?
Mm-hmm.
Tooth loss, whether due to trauma, decay, periodontitis, whatever.
Mm-hmm.
And these situations, require solution that um, would restore both function and aesthetic for the patient,
Right.
it is in those moments that one starts thinking, okay, what's the best solution here? And for me, I started growing interest in implantology, and I realized how life-changing implants could be,
Right.
providing patients with a permanent solution that mimics natural teeth, and it can improve their confidence and quality of life.
Mm-hmm. Mm-hmm.
Um, Um, I would say obviously we all have a lot of good memories, right?
Right.
Maybe strongest moment that helped me to, solidify my interest in implantology came early on when it was a family friend in her late 40s, I would say. She came to me, she had a lot of problems, a lot of issues, dental, and then she wasn't comfortable smiling confidently or even eat comfortably. So she's been dealing with partial denture basically. And because of her appearance, she wasn't very happy with it. So when I suggested the dental implants as a solution, and I'm sure she was, given this solution by others too, probably before me,
Right.
uh, but she was hesitant, worrying about the procedure, obviously, the name of surgery, and then the cost to it, and everything. So
Right.
ultimately, after talking to her, she trusted the process, and
Mm-hmm.
after the completion of the treatment, the reaction was unforgettable, I want to say. She almost cried. Of course,
Wow.
that was out of joy, right? Telling me that how she felt like and how she regained her life.
Mm-hmm.
And that case stayed with me up until, today, showing me
Right.
how dental implants can transform one's life.
Of course. Of
Yeah.
course. And I think that you found the best of both worlds, right? Because what I mean by that is you were passionate in computer science and you were passionate about dentistry, and you found a way to combine the both of them in digital dentistry, and it's just kind of funny how you did such a great job at combining both of those passions, and it turned into something tangible, like helping someone regain their confidence and happiness in life, right?
Yeah,
Thank you so much for sharing that. And that leads me into my next question.
sure.
So you've been instrumental in mentoring dentists. I mean, I know that you've done a lot in the clinic, and you've taught many dentists, about implants and all on X. How do you see mentorship impacting the confidence and skills of practitioners learning to perform these all on X procedures?
Hmm. Okay. Good question. I would say um, mentorship has been a big part of my journey. Maybe not from the beginning, of course, but at least in recent years, I want to say.
Uh-huh.
And I truly believe it makes a huge difference in helping dentists building their confidence and skills, right?
Mm-hmm.
Especially when it comes to more advanced areas like implantology. Um, all in X procedures, they really require you to have a solid grasp of treatment planning, be
Mm-hmm.
precise, and deliver the results that can truly change a life.
Mm-hmm.
Uh, I know many dentists, it can feel like a very steep learning, and that's why having a mentor is important. For
Mm-hmm.
some, I've seen mentorship doesn't just speed up the learning process, it also gives practitioners the confidence they need when facing more complex cases.
Mm-hmm.
When I mentor someone, or dentist, I want to say, my goal is to create this supportive, collaborative space, right?
Okay.
So they can feel comfortable asking questions, try new things, and yes, maybe making mistakes. Why not? I like to work side by side with them, starting from treatment planning, using digital workflows, all the way to the live surgeries. And during the whole process,
Mm-hmm.
um, I'm there to guide them through any challenges and make sure they understand the why behind every step.
Mm-hmm. Mm-hmm.
I would say another big part of mentorship is introducing technology, things like, um, guided surgery or implant planning, 3D printing, and those have totally changed implantology and making procedures like all in X, uh, you know,
Yeah.
they can make it more predictable.
Mm-hmm.
Um, I would say I always want to make sure to train on how to use these technologies to improve the results. And once they see how digital workflow make them, make their treatment planning easier and more precise, it really boosts their confidence and help to deliver better outcome for the patient.
Right.
Um, yeah, I think it's all about giving dentists the tools and confidence to change lives,
Mm-hmm.
and by building their confidence, sharing knowledge, it encourages freshest idea.
We
So.
appreciate that you are taking the time to educate dentists and mentoring them to learn all of these new technologies as they come out. Because in reality, implants are becoming a standard of care, right?
Mhm.
Implants have become a standard of care, and
Absolutely.
you helping dentists, learn all of the new advancements coming out is so incredibly helpful and useful. So, like, the 3D printing aspect of All on X and the predictability of those results and the efficiency of using 3D printing in All on X, that's an example of something that you are helping a lot of dentists learn. That's incredible. And I really am so grateful that, you're doing that for our industry. Thank you so much.
Oh, absolutely.
And I also love your take on mentorship because it can take months to years for these doctors to actually learn what they need to do to be able to successfully place implants. And you're cutting that time frame down by so much just by being there and helping them along the way. And that gives them the tools and that gives them the confidence to successfully do a procedure. So I really admire that. For my next question, it's going to be, in your experience, what sets TRI implants apart from other systems when it comes to achieving successful outcomes in all-on-X cases?
So basically, talking about benefits of TRI, in my experience, TRI systems really stand out as an innovative system. What makes TRI unique isn't just one thing. It's a combination of, smart design, digital integration, simplicity, that
Mm-hmm.
all come together to make a great clinical result, I want to say. Um, I would start with the patented abutment-free, design of the TRA system. It's truly revolutionary.
Mm-hmm.
The traditional system rely on, abutment connection. between the implant and the prosthesis. And I call, abutment after I learned about TRI, I call abutments as the middleman's here because they act like a middleman, right? They
Right.
connect the implant to the prosthesis.
Let's cut them out.
Yeah, let's cut them out. So nobody likes middlemans, right?
That's right.
So I would say these middlemans or these abutments, we originally introduced them 30, 40 years ago because we wanted to correct the implant angulation. Due to the limitations of the system and the technology and everything, we needed something here to correct that kind of angulation.
Mm-hmm.
At the same time, we needed something to transfer, the mastication loads and the forces.
Mm-hmm.
But we know that they come with a lot of problems and limitations. Abutments create, potential weak points in the whole system, and they also add unnecessary complexity. When we're talking about tie bases and cementations and those kind of things, we know that it always leads to debonding or sometimes peri issues.
Right.
The other, issues with the abutments, we all have, experienced the frustration of choosing a wrong, MUA height or angulations and, redos that we have to do for that purpose.
Mm-hmm.
Or getting the screw loosening or screw breakage for that purpose. And maybe not to forget, of course, the inventory we have to keep because of the MUAs
Right.
and the price tag that comes with that kind of inventory keeping. So TRI system eliminates the need for any abutment, right? And
Right.
allowing for a direct connection between the implant and prosthesis. This not only solves all the issues that come with the abutment, but also simplifies the restorative process. It
Mm-hmm.
reduces the risk of micro movements that happen between, the abutment and the implant, and eliminates the screw loosening, which is a common headache in the full arch case specifically.
Right. Right. I saw a video of the founders of TRI putting how much weight, on the was it the screw? What were they doing there? Can you explain that?
Sure. So this was a test. It was a live test actually that we had in one of the events. The video shows a room full of people, and then a natural, a human being on an average can basically have about 80 kilograms of force
Mm-hmm.
applied during the mastication, or maximum, I want to say.
Mm-hmm.
And then the test was, okay, how much the system can withhold the pressure. Now, as you know, the TRI system, like I said, there is no abutment, meaning that we have the implant, we have the restoration, which sits directly on the implant.
Mm-hmm.
It's not internal hex or internal, conical or external hex, nothing. It's just sitting on the implant. And then
Wow.
there's a very bold screw which passes all the way through and keep them all together.
Right.
So the test was, okay, how much these can hold, the screw, the implant, and the restoration. So
Gotcha.
in order to even make it more what do you call it?
Difficult?
Exciting or difficult,
Yeah.
yes. So they put it at the 30-degree angulation. So
Wow.
the weight and the load comes at an angulation. So then they started adding it to it. They reached to the point that it says 80 kg, and the people are keep shouting, add more, add more. So they
Yeah.
kept adding more and more and more until they got to 178 kg, I think,
Oh,
and they
wow.
actually ran
Gosh.
out of all the weights that they had.
That's crazy.
So yeah, it was funny. Nothing happened. But what is amazing in that video, they had the tooth. Of course, they had the implant and the restoration in there, and then they had kind of stainless steel plate or something,
Yeah.
and then on top of that, they started adding the weights.
Yeah.
So when they removed everything, they show that because of the load, there is a marking created by the zirconia restoration on that piece of metal.
Okay.
There is an indentation basically on the piece of metal there was so much
So
load.
the metal failed before the zirconia did.
Yeah,
Yeah,
That's
yeah.
crazy.
That's incredible.
that's
And
really incredible.
something that I came to know about TRI is, let's say that we know that it doesn't have an abutment, right? And that there's like a collar. Is there like
Yes.
about 1.5 millimeters long collar on the
Yes.
end of the implant, right?
Mm-hmm.
And tell me if I'm mistaken, but because you don't have the multi-unit abutments for an all-on-X case, is it possible to provide a prosthesis, that I guess has the correct vertical dimension of occlusion to make it so that you don't need to do an alveoplasty on the patient in order to get the prosthesis to fit?
So, good question. So yes, there are two implant types. One we call it multi-level and a bone level. Multi-level is what you're referring to that has got that 1.8 millimeter anodized color, which is pink in color. And then definitely that height is giving us, a little bit of room in a normal case when you're dealing with an all-in-X, if you have to, what do you call it? Um, so,
Like
so,
shave
so
down the bone? Is that what you're
exactly, you
saying?
have to
Yeah.
shave down the bone and basically to compensate for the abutment that you're using.
Yeah.
But here, because you don't have any abutment, basically you may not need to do that. And because of the multi-level ability of the collar, you can place the bone level anywhere on the collar.
Mm-hmm.
So you can play with that height. If you need to, you can go a little deeper. And so that, again, you don't have to shave to compensate for the height of that collar. So it's a
Wow.
very very unique kind of implant that you're dealing with here.
Wow. I mean, I know a dentist who has had a lot of success with the TRI system who he hasn't needed for 9 out of 10 cases that he's accepting, that is, right? Because it's all about case selection. But
Yes.
for 9 out of 10 cases, he hasn't needed to shave down any of the bone. He hasn't needed to perform any alveoplasty to create more room because the TRI system doesn't have multi-unit abutments, right?
Mm-hmm.
And so because he hasn't needed to do that for these cases that he's working on, the patient doesn't need to undergo, the experience of getting their gingiva completely, sliced open, from second premolar to second premolar, from second molar to second molar or whatever, right? And get all that bone reduced and get it sutured back up and have to heal, and the bruising and the soreness, that can come with it. And
Oh,
not
absolutely.
only the patient experience, right? But also the learning curve that a lot of these dentists, go through is possibly a lot shorter because they don't have to, in a lot of cases, worry about if they're selecting the proper cases, right? Doing an
Yeah.
alveoplasty because of not needing a multi-unit abutment in the prosthesis, not needing the vertical dimension of occlusion to be as large.
Oh
So,
yeah,
do I
100%.
understand that correctly?
Oh, absolutely. You're on the right track. So you're 100% right. It like I said, the simplicity of the system here helps a lot of dentists, whether they are already dealing with other implant systems or they're new to implantology, to adapt this system much, much faster. And learning curve is much, much, smaller compared to any other system.
Wow, that's spectacular. Thank
Aw-
you so much for sharing
Of
that.
course.
Awesome. So, and switching the topic just a little bit, what are the most common challenges dentists face when transitioning to placing implants? And how can this new TRI system mitigate those challenges?
Okay, good question. Uh, I would say challenges in transitioning into implant system. Um, you know, Transitioning into implant dentistry is by itself a big step for any clinician, right?
Mm-hmm.
Yep.
it definitely comes with its own set of challenges. One of the toughest part is again, we were just talking about it, the learning curve. Dentists move from general practice to implantology often feel uncertain about things like, surgical techniques,
Mm-hmm.
treatment planning, dealing with complications. Oh, what happens if what do we do if it happens like this or that? So this can be particularly scary when, stepping into advanced procedures like all NX. That's even more scary now.
Mm-hmm.
So we know that with that, the precision and confidence are the keys.
Right.
Another challenge is choosing the right cases, right?
Mm-hmm.
And having the right communication with the patient. A lot of dentists, I say, they find it tricky to identify the best case to start with and
Right.
explain the benefits and limitations of the procedure to the patients. It is a kind of a balancing act. Having the technical knowledge is one thing, but educating patient, especially when it comes to things like cost or managing expectations, which can be tough, is something else.
Mm-hmm.
Um, I would say the maybe the other challenges on getting a new system or the workflow is running them successfully.
Mm-hmm.
Placing implant requires a good and smooth collaboration between the clinical team and the lab.
Mm-hmm.
For dentists who are not used to digital workflows or the specific protocols, this transition can definitely feel overwhelming.
Mm-hmm.
This is where systems like TRI implants really stands out,
Okay.
and they make everything easier, by providing streamlined, full digital workflows that can cut down the complexity.
Okay. Okay.
You
That's
know,
incredible.
yeah.
That's incredible. How do they help cut down that complexity?
So I would say mm, one is, they make it easier by, first of all, streamlining it. They're being digital, so a full digital workflow can help here. It can
Right.
definitely cut down the complexity. At
Right.
the same time, they can, but again, because of digital, they can boost the precision. It also not for TRI not having the abutment or removing the need for abutment, so dentists don't have to juggle as many components as they need to, or think of different aspects like you just mentioned,
Yeah.
leveling the bone or those kind of things.
Right.
So this is not only reducing the chair time, also making the learning process much smoother for the clinicians.
Right. No, that makes a lot of sense. Thank you for sharing that.
Yeah.
That brings me to my next question.
hmm
So, what is the immediate loading technology look like with the TRI system? So, like, how does TRI's focus on immediate loading technology impact the surgical
hmm
workflow and the patient satisfaction? So, like, once the implant is placed, what does that look like for the patient moving forward until it's fully healed?
So I would say on the immediate loading, TRI dental implants focus basically on immediate loading.
Okay.
Has been a game changer, both in terms of clinical workflow and patient satisfaction. Let's put it this way.
Okay.
From a clinical standpoint, the TRI matrix implant system makes the workflow so much easier. It eliminates the need for abutments, and the workflow is seamless with digital workflows, making the entire process way more, efficient. So, for example, when you're placing a single implant in a static zone, like anterior, let's say tooth number 7 or 8, right?
Mm-hmm.
What are your usual options? Are, doing a flipper or an Essex retainer, or doing a chairside temp, using a metal cylinder copen, which, can take forever.
Right.
But with the matrix system, you can deliver a beautiful 3D printed temporary in just 60 minutes. That's from the
Wow.
time yeah, really. And that's really happening every day around the world. From the time
Oh my gosh.
doctor starts placing the implant to scanning, getting the design, printing, and delivering the temp. It all
Hmm.
takes 60 minutes.
Oh my
So
gosh.
that is really game changer,
Yeah, it is.
especially for the patient, right? So patient don't have to worry about being without a tooth or going out with a flipper, which jumps out every now and then, like in
Right.
traditional methods. So this really gives a beautiful aesthetic tooth right away to the patient. So psychologically, emotionally, you can imagine what the kind of huge impact it's going to have on the patient, right?
Right. And that kind of, if you don't mind me asking, so the 3D printing component, does that go pretty hand in hand with the TRI temporary restorations?
I would say yes. So you can always mail too, but if you want to make it happen, quickly in like 60 minutes, I would say 3D printing probably is getting faster and faster today compared to milling. Some people may
Uh-huh.
disagree with me, but I feel, yeah, I feel 3D printing was not there like 2 years ago, but now definitely 3D printing is taking over. But anyway, at the end of the day, what makes it happen is the simplicity of the system. You don't have to, not having that abutment and the simplicity and digital integration of the system altogether. It's not just one thing altogether as the whole, product come together and making this possible to provide those kind of solutions to your patient.
Absolutely. Do you think a lot of dentists who would be interested in using TRI or who are currently using TRI, do you think that they are 3D printing in their own offices, or do they send out the scan for the 3D printing and then, or how would you recommend that work?
So I would say most of the doctors that they are doing using TRI implant system, they have 3D printer in-house.
Okay.
And so it's easy for them, to go through this process. Basically, some some of them they even have designer in house. But the good thing about the TRI is we do have our lab within US in California. So you can always book a designer ahead of a time. Once you're
Hmm.
done with your surgery, you just upload your post-op scans. They design it, they get back to you, and then you have the design, you print it in house, and you deliver it.
Wow.
For those people who do not have the printer in-house, then the solution is we again have a solution for them. Once they're done with their surgery, they can upload their scans, we design it, we print it, we deliver it the next day. Of course, it's not going to be a 60 minute like, the other case, but at least the patient can again have the tooth within 24 hours. We
Right.
can always work with their own lab of their choice if they have a lab, down the street or, close by and they want to work with them. We can always help the lab to get certified, design for a TRI, print in the lab, and deliver it to the doc, in a couple of hours. That's another
Wow.
possibility,
There's a lot
right?
of possibilities there.
Yeah, for
That's
sure.
great. That's so exciting. Thank you for sharing that.
Of
And
course.
I love that, making sure the patient gets their tooth in as quick as possible so that they don't have to worry about their missing a tooth while trying to smile for something or having difficulties eating.
Absolutely.
Yeah. So, can you elaborate further on the role of TRI's digital workflows, such as the matrix system, in improving precision and efficiency for complex implant cases?
Okay, good question. TRI is all about digital workflow, right?
Hmm.
Yep.
Especially with the innovative matrix system. They have completely changed how we handle complex implant cases. With dentistry moving more and more towards digital technology, TRI has really stepped up, providing tools that make implant procedures more precise and efficient. Um, so the matrix system eliminates the need for abutment as we discussed. But at the same time, the matrix system was built from ground up, thinking digital, right?
Okay.
This has several benefits I want to say. Usually, I want to say, okay, let's take a step back. Implants came into to our lives like 30, 40 years ago. At that time, digital technology was not there or it was very minimal. So as the digital was growing, we had to use the current implant systems working with the digital, basically, right?
Mm-hmm.
Or digital working with the implant system. The matrix was built from ground up, considering the digital technology that we have, and they made it in a way that it is meant for these digital, and that's the differentiator, which
Okay.
brings up a lot of benefits, like improving the precision, right? The digital workflow makes every step super accurate. We all know that.
Right.
Tools like intraoral scanner. We do have the scan bridge, which is the next to photogrammetry or photogrammetry.
Right.
From collecting the data to transferring to CAD/CAM system, all of that, even printing, all of that is coming from the digital dentistry. And because of matrix integration, definitely it helps to ensure that the final restoration fits perfectly, or the whole process, is gonna go smoothly.
Right.
Um, then I would say streamlining efficiency could be another one.
Okay.
Traditional implant workflow usually use multiple appointments, whether it's a temporary, try-ins, bunch of adjustments, all of that. But with TRI digital workflow, we cut down a lot of that. And planning the case from start to finish makes the whole process more and more predictable and speeds up.
Wow. That's pretty
Um,
useful.
yeah, absolutely.
I got, another question. Thanks for explaining about the matrix system. I think that's a really innovative system that you guys use
Hmm.
that helps make everything much simpler, especially when it comes to restoring something that fits properly.
Yeah. Oh,
Thank you.
yeah, absolutely.
I
Absolutely.
feel like, a lot of dentists. Now let's talk about scaling. This might be the last topic we have time for today, but let's talk
Okay.
about scaling all on X procedures. Many dentists, they struggle to scale. A lot of dentists, let's say that they're doing one all on X every single month, right? And they're like, dang, I really wish I could do 5. I really wish I could do, heck, 10. I'd
Oh,
love to
yes.
do more, but I just can't. And so, what strategies or tools have you found effective for increasing case volume, maintaining quality, just helping dentists maybe scale and do more all on X procedures in their practices?
Um, Good question. All right, that's $1 million question.
Yeah, this is a pretty good one.
So, I would say scaling all NX procedures, while keeping the quality top notch can be tricky, right?
Right,
Because we
right.
want we want the quality and the quantity. I think with the right tools, strategies, and the right mindset, it's definitely doable.
Hmm.
I would say master the workflow, right?
Okay.
Because there are different components when you're scaling. It's not just having the volume walking in, it's all the components. So
Hmm.
I would say mastering the workflow is the key to scale any procedure, no matter what you're doing, right? At the end of the day, is it's important. And for that, I would say do a detailed case planning. Make sure that you understand your case and what you want to do.
Hmm.
Streamline, your team collaboration and work closely with your lab. Get aligned with them. Uh,
Hmm.
Create a consistent process. Make sure the whole team, whether it's an assistant, it's a lab tech, everybody follows the same step. You don't want to, reinvent the wheel or do everything from scratch every time.
Hmm.
Leverage again digital tool and technology because that is the backbone of scaling up.
Okay.
That can help you to speed up and to get more precision and avoid redos, basically, right?
Mm-hmm. Mm-hmm.
The next, I would say, um, educate your team and and basically empower your team. I want to say it's not a one person job, right?
Right.
Let the team knows that um, basically educate them and get them ready and get them confident enough to be by your side by training them and supporting your staff, right?
Right.
Start delegating tasks to them. I see doctors that, they do scanning, they do printing, they do this, they do that. But when you go to an office that, they do like 6, 7 arches a week, then, or even more, then that's not what doctors is doing. So
Right.
they're delegating tasks
Okay.
to the staff and keep themselves, focusing on only the surgical aspect.
Right.
One of the biggest challenges maybe that dentists face with is dealing with, patient hesitation or basically case acceptance, right?
Mm-hmm.
They may not fully understand the procedure. I mean, patients obviously it's a complicated case, especially when we're talking about LNX, or feel confident about moving forward. There could be different reasons, of course,
Right.
but I feel to overcome that aspect um, is, first of all, you want to communicate easy, simplify that kind of communication, right?
Right.
Use visual videos, digital mock-ups, things like that the patient can easily connect and communicate, and then
Uh-huh.
explain the treatment planning and expected outcome. And then you can highlight the benefit, focus on positives, like better function, improved aesthetics, how it can enhance their quality of life.
Yeah.
um, I would leverage the testimonials and share the success stories of the other patients, whether I have a video of them or the review that they have left, that they can naturally boost the volume. Um, I would say referral network could be
Mm-hmm.
another thing, right?
Right.
That can help us to, scale up or basically increase the stream of patients, um, you know, collaborate with the other dentists, within our network,
Mm-hmm.
even reaching out to community like hosting, seminars, webinars, I don't know, study clubs, which can educate whether patients or doctors or
Mm-hmm.
professions can help. Marketing, you know, I mean, today's social media, you know, y- they can, they can definitely take advantage of that, do targeted ads, marketing,
Right.
social media, and all those kind of things. I think
Right.
they can definitely help to, um, in your overall, scale up.
Wow. I mean, now that is quite the incredible list of recommendations, Amir. Wow. Thank you so much for sharing so many valuable things that a dentist can do to not only help a patient accept treatment, right? Which is
Yeah,
at the end of the day, the most important thing, but also understanding the workflow that needs to happen, not just digitally, but in your office too, like knowing how to delegate and knowing how to streamline the process, working with your staff and helping them know how they can help to make everything run smoother and run more efficiently and quicker. I know a dentist who is doing TRI implants, a separate one from the one I mentioned earlier, who is doing about 4 to sometimes 6 all on X cases in one day.
wow.
One day, and he uses a TRI system. It's incredible. And but I don't know if he does that every single day, but he has done it and successfully. And
I
I
think
think
I
that
know who you're talking about.
yeah, I think it comes down to educating your staff, and so that they know
Absolutely,
exactly how to help
absolutely.
make it so that you aren't the one doing every single thing, because in that case you can't do 4 to 6 all next
No.
cases in a day.
It's all about efficiency, and efficiency comes from practice and the simplicity and streamlining.
Exactly. And I'm really grateful that, TRI is able to help educate and teach dentists how to do such things. And we really appreciate you coming on here, Dr. Amir. I think we ran out of time today, but thank you so much for sharing all of this incredible advice with us. We really appreciate it.
Oh, absolutely. It was really fun, and I really appreciate having me here. Thanks to both of you. It was a great experience to be with you guys.
Oh, thank you.
Absolutely. And if anybody wanted to reach out to you to maybe pick your brain more about TRI
Sure.
or need some mentorship help, what would be a good way to contact you, a good email or phone number?
So definitely, yeah. My email address is Amir, AMIR .Gordji, my last name GORDJI at tri-implants.com. And they can either email me. I'm on, Instagram, LinkedIn. Instagram is Amir Gordji DDS. Same for LinkedIn. They can always reach out there, or they can call me directly, 949-943-9540.
Thank you so
Awesome.
much.
Sweet. Really
Excellent.
appreciate you coming on here with us, Dr. Gordji.
Absolutely.
Thanks for tuning in to the Revolution Dentistry podcast. If you're finding value here, make sure to hit subscribe so you never miss an episode. We're here every week to help you grow. See you next time, everybody.